Dr. Carlos Cárdenas.
Thank you, Marcy. Now, a number of you have known me a long time. This isn't that, early in addition here, but we have the ability to see when we wear our peepers. So I'm glad to be here this morning. What a historic day. This is really exciting. Many of you have been with us along this journey. We began this journey with a focus on the next generation of physicians. Graduate medical education was the focus, and we founded the 4 core programs that created the foundation of what has become a graduate medical education and medical education pyramid. We are here to bolster that vision again today. I want to thank all of you for joining us. DHR Health remains committed to improving the health care of the Rio Grande Valley and people who we serve in our community. We have proudly grown into one of the largest healthcare delivery systems in the region, from a level 1 trauma center to a top-tier transplant program, expansive rural initiatives, and the highest level of neonatal intensive care. Graduate medical education and training medical residents have always been a top priority for us and a focus. Today, we will share some exciting news about how we will continue to train and mentor the next generation of physicians that are greatly needed in our state and other parts of the state as well. I would like to ask that all of our elected officials please stand and be recognized. Thank you so much for being with us. We thank you for your leadership and advocacy. It's speaking with one voice that makes great things happen. We continue to do that, and all of you are that voice. Your support and service have been integral to our success and the success of our area. Before we continue, I would like to share a brief video from our Lieutenant Governor, the Honorable Dan Patrick.
Hi, I'm Dan Patrick, proud to be your Lieutenant Governor. I want to congratulate DHR Health and Texas A&M for embarking on this great endeavor together. This will be great for the Rio Grande Valley and for Texas. I can't wait to see what's next.
Now it's my great pleasure and a singular honor to be able to introduce one of our esteemed guests. This man is no stranger to the Rio Grande Valley. He has been at the center of a lot of the great things that have happened in our area, and it gives me great pleasure to introduce the leader of one of the largest university systems in the country, Chancellor John Sharp, Chancellor of the Texas A&M University System. And it is my pleasure to let you know that he has been a true advocate of advancing education and access to health care in South Texas. Welcome, Chancellor Sharp.
Howdy. When I was Controller of Public Accounts, we did a study that had a huge impact on me, and that study basically said that what industry wants now, prior to that time, what they would come into town and they would say, okay, I'll locate there, but I want this big tax break and I want this, and they still want that. But what's important to them now is 18 to 24-year-olds that are well educated and healthy in the neighborhood. And when you looked at Texas, San Antonio South is where those kids were. The only place in the country that had more 18 to 24-year-olds than South Texas and the Rio Grande Valley was Provo, Utah. All you gotta do is think a little bit about Provo, Utah. Good Mormon family has 8 kids. And so we started figuring out that there has to be an emphasis here. So when I became Chancellor, I had a meeting with Alonzo Cantu and several of his folks. We had a series of meetings about things that the Texas A&M system could do in the Rio Grande Valley, which we considered the most important part of Texas for economic development because of those children. Because if those 18 to 24-year-olds are not educated and not healthy, you get to join Mississippi, Texas does, in economic development disasters. If they are well educated, the largest group of young people in the country, and healthy, we create an economic boom in this state bigger than oil, gas, cattle, cotton ever was in the past. That's the future. This is the future. And so the things that sprang from that, engineering academies at South Texas College, the McAllen Center, where this is the only place outside of College Station, Texas, where you can never leave home and get a degree from Texas A&M University and wear the same ring that everybody else has in the McAllen Center. We're adding a nursing facility to there as well. Just finished training 10,000 kids in advanced manufacturing in Brownsville. With Mondo's help and Chewy's help, fixing to expand that into McAllen in the next session of the legislature. So many things that have happened here, but this one to me is very special. I actually used to be a partner in this hospital. Wish I'd never sold it, to tell you the damn truth. But this is a special one to me, where we can have a collaborative relationship with one of the great hospitals of Texas in graduate medical education and research, in a partnership where both of us work together, understand what the common goal is, and the common goal is not about A&M, it's not about Renaissance, it's about those families that are the backbone of what the future of Texas is going to be. This is going to be a great relationship, and I can't wait to see, like Dan Patrick said, I can't wait to see where we go from here. But knowing Alonzo and the team and the folks that we're able to work with here, this is going to be fantastic for a whole bunch of young men and women and the people that they take care of in the future. Thank you, and God bless you.
Well, thank you, Chancellor Schott, for being here today and for your unwavering support of our efforts to continue to train the doctors of the future right here in the RGV. I would like to now introduce and welcome Dr. John Mogford, Chief Executive Operating and Senior Vice President, Texas A&M Health.
Dr. Cardenas, you captured the right word, which is exciting. And I do want to start off by a few thank yous. Mr. Cantu, Dr. Singh, Chief of Staff, Padilla, Ms. Turley, thank y'all for the diligence in getting us to this agreement and working so collegially with us. It was fast and furious, but it's really been built on a long relationship. So we view it as an expanded relationship. And we've watched over the last almost 7 years, particularly with the pharmacy graduate medical education, the momentum that DHR has been creating around new clinical programs, new research capabilities. It's been fun to watch, and it is exciting to become part of it and partnered with you, because we feel like that we can expand and accelerate the work that Chancellor Sharp was talking about to positively impact the health of the population of South Texas and then beyond. The A&M system has a multitude of programs that are already focused on the health and well-being of the population of South Texas. Most notably, our Healthy South Texas program, a brainchild of the Chancellor, that combined the capabilities of the A&M Health Science Center with the outreach and community engagement of the A&M Agriculture Extension agents. And this program as we think, has been a phenomenal success, and this expanded affiliation will provide better outreach capabilities for all of us into the rural communities, into all communities, for both parties, by improving the options for patient navigation, for enhanced access to specialty care, while allowing us to more and more focus on preventive health services. And that is really why we're all here. We really are very excited also to expand our clinical research activities. All along the way in talking about the graduate medical programs, we've always spent about the same amount of time talking about clinical research, even basic research that we all do, and how we can align it, how we can partner and accelerate those discoveries. And we are planning to collectively expand those options, those programs, so that the population of South Texas has continued and expanded access to novel life-saving therapies or to participate in clinical trials. New discoveries, as we see every day, are being discovered all around the world. And we believe that through this collaboration, we can continue to bring those new discoveries and knowledge to bear on South Texas. So I'll close by simply stating, we're really proud to be here with you and very excited about that. Thank you very much.
Well, thank you, Dr. Mugford. Next, please help me welcome Dr. Kip Owen, our very own Aggie, DHR Health Board member and orthopedic surgeon, for remarks on our affiliation. Dr. Owen.
Good morning. Good morning. Chancellor Sharp, colleagues, friends, family, fellow board members. It's an honor to be with you today. When I was invited to attend, I stopped and reflected. It was 40 years ago this month that I moved my family from California to College Station, Texas, to begin a new career path. I chose to move to Texas A&M University because of their commitment to excellence. Their vision at that time was to become a world-class university. I was impressed by their support for the U.S. military and veterans. They had a strong focus on community and family. I then joined 48 like-minded students at the College of Medicine. We shared a focus of excellence in medicine, rural health care, and serving the underserved. My training at A&M also gave me an opportunity to meet and work with my esteemed colleague, Dr. Cardenas, for the first time. Let's move forward to the year 2000. I was invited to visit day surgery at Renaissance and consider moving my orthopedic sports medicine practice here. At that time, Renaissance was a surgery center founded by 8 physicians with vision, partnered with community business leaders who shared that vision. Some of those people are still here in this room today. Their vision was to provide world-class health care at home for underserved and rural patients, to provide health care for our population so that patients didn't have to travel to other major cities hours away elsewhere in Texas. Which brings us to today, 2023. The Texas A&M Health Science Center now trains 700 medical professionals on 5 campuses. There are more than 153,000 student Aggies across the state of Texas. Since I attended Texas A&M, the system has added 8 new campuses, now totaling 11 across Texas. Texas A&M remains committed to medical education, to serve the underserved, provide medical access, and to innovate in healthcare delivery. During that same time frame, DHR Health has grown, providing 578 patient beds with 5,000 employees and over 600 doctors. Impressive growth. Our system is now expanding to 3 campuses. DHR Health is committed to its role as an academic teaching hospital. The partnership between DHR Health and Texas A&M is a coalition created by shared vision for medical education. This partnership creates a team committed to excellence to provide world-class health care at home today and in the future, to innovate in the delivery of health care and to educate medical professionals who will provide ongoing health services for our community, our region, and the state of Texas. Gig 'em.
Thank you, Dr. Owen. I see we have some fellow Aggies of his in the audience today. And now we want to just say again, thank you for your continued leadership, for being a huge part of what we do here at DHR Health. We're going to hear now from Dr. Amy Ware, Dean of the Texas A&M School of Medicine.
Howdy. Gotta get used to that. It's a delight to be here. Thank you all for being here. Thank you, Alonzo and your team. It's been a pleasure working with you over the last several months to get to this point. So we're very grateful to be here. This partnership aligns with the Texas A&M University School of Medicine and our founding mission. And that is to train physicians to serve and heal all Texans, particularly those in underserved areas, and particularly in the Valley. The Texas A&M University School of Medicine is a community-based medical school. We have 5 campuses across the state, and we leverage our clinical partners, such as DHR, to train our future physicians. This unique model gives us an advantage in reaching numerous patient populations throughout the state and provides our Aggie doctors, such as Dr. Owen, with a broad experience and perspective. We are proud of our almost 800 medical students currently studying at our Texas A&M School of Medicine. And like all medical students, our Aggie doctors will join other new doctors as they start their medical specialty of their choice as residents. However, it's not enough to just graduate excellent medical students. We want to continue their training here in the state of Texas. The latest physician supply and demand projections from the Department of Health and Human Services underscore greatly this need. Only 49.4% of Texas medical school graduates stayed in Texas for their residencies over the last 20 years. It is also important to note that all primary care specialties are projected to have residency shortages going forward. We are committed to expanding our graduate medical education footprint to address this critical need, and this is why this partnership is so important. Together with the Texas A&M system and the Texas A&M Health, we are doing that in the Rio Grande Valley with today's edition of the DHR Health residency programs. We already have one of the largest geographic footprints in graduate medical education across Texas, and I am so excited to add more maroon here in the Rio Grande Valley. With more than 100 residents accepted, this partnership will be amongst our largest graduate medical education affiliation, and we're very grateful for that. We know that doctors tend to stay where they train, and so we hope that more physicians will choose this area as their home. Our goal is to leverage the collaborative efforts of the Texas A&M Healthy Texas Initiative and the School of Medicine's Rural Medicine Program to bring even more healthcare programs to the Valley. So thank you to DHR Health. We look forward to our future residents complementing and enhancing the patient care experience to better the life of all Texans. Thank you so much.
Well, thank you, Dr. Ware. Please now help me welcome Dr. Manish Singh, our DHR Health Chief Executive Officer.
Thank you, Mark. Hello and good morning to all. Howdy. Yes, howdy. From today, it's only howdy. Thank you. I'm extremely honored to be here today for this incredible announcement. This alliance is aimed at training the future clinicians that will advance high quality care. Through these programs, we aim to ensure that we will train physicians to provide world-class healthcare for generations to come, with the ultimate goal of continuing to improve the health and well-being of our Rio Grande Valley community. Residents will receive training in state-of-the-art facilities, and it is with great pleasure that I stand here knowing that Texas A&M and DHR Health have shared vision and commitment to graduate medical education and enriched partnership. Thank you. At this time, I would like to invite all my fellow colleagues to come down and for the signing celebration of the affiliation agreement.
So now we're going to make this official.